Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
Hello, this is Tim Fergestad. Thank you for joining us. I'm very pleased to have James Bates with me here today. James is an accomplished CEO, entrepreneur, and board member who has created and led high-growth execution for several technology companies. Presently, James is CEO and founder of AdviNow Medical, with his lovely background. The world's first artificial intelligence and augmented reality-driven automated medical visit platform. James conceptualized the idea, wrote the fundamental patents, raised $20 million in capital, recruited the team, launched the company. He's the general partner in a fintech hedge fund that uses artificial intelligence to deliver market-leading returns. James is also managing partner of A Big Capital and invests in technology startups, real estate, and fintech. Welcome to the show, James.
Thank you, Tim. I appreciate you having me.
There's a lot of great stuff there. So it sounds like AdviNow is your focus at the moment, though, or how does that work? You split your time?
I'm 90% AdviNow, 10% other. But since I work 100-hour weeks, I still get well over my 40 hours a week into AdviNow.
Okay. Excellent. So let's do a quick snapshot of AdviNow then, right now.
Sure.
What you do there, what the company does.
Yeah, so AdviNow uses artificial intelligence to completely automate the medical visit. And when you say that, a lot of people don't know what that means.
Mm-hmm.
An AI actually engages with the patient and does everything they would do at the front desk, so all the registration, all of that easy stuff. But then the AI will actually do a preliminary differential diagnosis on the patient. Through a chatbot experience, it'll ask every question that a doctor will ask. The AI will, or the nurse,
all this, the preliminary stuff, everything.
And then the AI will prep any orders, images, labs, anything the patient may need, and automatically schedule those with the patient. So by the time the patient sees the doctor in person, the doctor has a complete summary of everything that they need to talk with the patient about. And then the doctor just needs to click on, I agree with this illness, or I agree with this condition. And when they do that, the AI will completely scribe a note that the physician would normally have to draft themselves, and then it will code it with medical coding. And so the physician approves it, and it documents it as if a human did it.
So just to back up, you said that before the doctor even comes in there, they already have their labs scheduled, but they don't have the orders officially put in to just.
Well, the orders would automatically be placed by the doctor, so we would justify it for the physician.
Right.
And the physician would order them before the patient arrives. So we want all of the labs and images to be collected before the patient sees the doctor. Many times there's no reason for the patient to see the doctor if you don't have that information.
Yep, I've been in that room a few times.
Yeah, absolutely.
Okay, so is there a lot of competition in this space? This is a very new and exciting time.
You know, AI is the buzzword. Every company says that they do AI, but the usage of AI is still somewhat elementary, specifically in healthcare. Anybody who's used ChatGPT knows that they could type in, what are the symptoms for diabetes? Or I sprained my ankle, what should I check for? And ChatGPT will spit out some nice things. But the unfortunate reality is you can't really use that in today's healthcare world. It has to be based off of peer-reviewed literature. It has to collect the data. A human doctor needs to actually evaluate, assess you, and make a decision. So using ChatGPT is similar to using Dr. Google, is similar to using WebMD. It's information, but it doesn't actually automate. So AdviNow is the only platform that automates from the very beginning of the encounter all the way through billing in the end that I'm aware of. There's a lot of companies that do little point solutions of what AdviNow does, like a digital front door, right, to register the patient. There's a bunch of companies that do.
Right.
There's a bunch of companies that have a microphone in the doctor exam room to record everything and a summary, a ChatGPT summary of what was said, right? There's a bunch of companies that do that. But ultimately, that's not sufficient for the efficiency of the clinic. Physicians that adopt AdviNow, they actually double the revenue per doctor.
Nice.
Part of that is the data that's collected and documented and coded is more comprehensive than physicians have time to do on their own. Thus, they get to bill more per patient, but they also get to see more patients without working more hours. So a big problem in the healthcare industry is physician burnout. But when AdviNow is adopted, our physicians end up seeing significantly more patients than they were seeing before, but they're working less hours and they're spending time doing the things that they went to medical school to do, which is spend time with the patients. This is something that may be interesting to you. In a standard urgent care, a physician will spend approximately 20 minutes on every patient. But they only spend 4 minutes in the room with the patient on average. They spend 16 minutes on the patient outside that exam room.
Right.
AdviNow eliminates that 16 minutes and allows the provider to just spend as much time as they need to with the patient, making sure the patient feels comfortable, making sure they understand their condition and what they need to do to treat them without making it a production line. And at the same time, they get to support their families and go home and eat dinner with them at the end of the day.
I can imagine that some other advantages would be well, first of all, the patient experience, right? They don't have to spend as much time talking to different people and doing everything redundantly. I feel like that's one of the biggest things I do is
absolutely.
I give all my information when I book the appointment, then I do it again when I get to the place, and then
you do it again.
Yes. Yes. So it's faster, but also I imagine the amount of staffing required, right? There's got to be a lot of redundancy and savings in that sense in terms of what's the term for paying employees? Payroll. Yeah.
You know, an interesting thing is that in a medical practice, there's always the office manager that knows how to do everything, right? Mm-hmm. They've worked there for maybe 10 years. They understand the nuances, the special cases. Oh, this patient is a Medicare patient. This patient is a Medicaid patient. This patient has United Healthcare's Plan B, whatever it is, right?
Yep.
They have memorized what the workflows are for each one of these patients.
Yep.
When AdviNow is used, the AI does all of that stuff. So now you don't need that person to work 12 hours a day and train each one of the front desk staff to get those workflows exactly right. AdviNow basically just presents it, collects the data directly from the patient, automates the workflow, and the front desk person can now just be a human engaging with the patient, making sure that they feel comfortable.
Okay. Yeah, I imagine these systems are already in place, but that data security is probably a big part of AdviNow, right? Having to make sure that all the HIPAA and all the patient information stuff is that a particularly annoying hurdle or expensive hurdle for software development?
You know, a lot of people put a lot of emphasis around HIPAA, but the reality is if you develop your system with security in mind from the beginning, and you think of every single piece of patient data has the same value as money, then you design your system with security and HIPAA becomes a check the box.
Right.
So our system was designed for security from the beginning.
Okay.
And as long as you're doing that, HIPAA is a very easy hurdle to jump.
Okay. I want to point out something that I learned recently, which was the use of AI in direct patient interaction. I think this was largely psychological, but that people were significantly more likely to share more important information with a computer than they were a real person, because it was too personal. They didn't want to say how many drinks they really had each week, or that they didn't really want to tell this young nurse that they do think about killing themselves sometimes or something. But if it's a robot, right, they feel they're more open and they give more useful information that can really help them.
Absolutely. And this has been tried and tested over multiple studies. That the classic example is, the 16-year-old girl who is become sexually active and
Right.
worried about getting pregnant. And so she sets up an appointment with a doctor who looks like her dad. And the
Right.
doctor's asking, well, how many men do you sleep with? And she's like, none.
Right. Right.
But if it's going in through a chat bot, then, all of a sudden she's putting the right information in there so she can get the health care that she needs for her specific situation.
Right.
The person who feels like they're going to kill themselves, but all of a sudden that's embarrassing, so they never want to open up and talk about it. But if you're talking with the bot, you're really willing to do that.
Right. Right. So there's a lot of added ancillary things. But I imagine, I mean, when you're presenting AdviNow, one of the biggest things is to the immediate client who is a practice owner. Is that right?
Well, our clients are anywhere from single practice owners all the way to large health systems like a Mayo Clinic is one of our clients, and anyone in between. So any medical practice or really any business that has a medical encounter would be a client of AdviNow.
Okay. Okay. What are sort of the adoption challenges you're dealing with? Like at the Mayo, for example, I mean, there's some people who are like, I'm not doing this. I want a person, right away or right. Because I'm sure there's some generations who really adopt it and some patients who are eager and some who are not.
Well, we haven't really seen those challenges because we designed our system to actually have a human ask the questions or to have the patient engage on their phone. So you always have a segment of the population, especially maybe the older generation, 60 plus, that are less excited about engaging with an app on their phone. Right. They don't want to click on a text message. They're worried about he's getting hacked. You got all these concerns.
Right.
And so with the AdviNow, they have the option to just call the front desk. The front desk would open up AdviNow on their side. They can just help patient. They click a button that says help patient, and then it opens it up. They don't need any training. They're just reading the same questions that a patient would normally answer themselves. They can now just answer on the phone. And so we haven't had any issues with patients refusing to use the system because we give them the option. If they're not technologically savvy, maybe they have poor eyesight and they just can't see the phone. They need another option. And so we're happy to provide that for them.
Right. Okay. Okay. Excellent. Excellent. And how long have you been running AdviNow, or how long has it been operational rather?
Well, it's been a long journey. The company was founded in December of 2016. We spent about 3 years developing the technology. And we released our product to the market in December of 2019, just a few months before the pandemic hit us, of course. And that has been a very interesting journey for us. But since the pandemic, that's when we really have been focusing on partnering with EMR companies like Athena Health.
Okay.
Athena is the third largest electronic medical record company after Epic and Cerner, which are large hospital systems. They focus mainly on smaller outpatient practices. And they've been a fantastic partner for us to eliminate the worry of onboarding, which has really been our biggest challenge.
Okay. Okay. Excellent. How would you, I mentioned this, we were speaking in a local event where we originally met, and I mentioned somebody else who was on the podcast, Dr. Alan Pitt, who has sort of an endeavor. He's a neuroradiologist, but he has a telehealth sort of service or whatever. And what sort of overlaps do you see with that sort of service in AdviNow?
Yeah, so AdviNow is not a teleservice, if you will, but we can be used in conjunction with telemedicine very effectively. So the AdviNow system is an automation system. It can be used in person. It can be used over video. It can be used asynchronously, which is over text message or messaging back and forth, right, where it's not real time. What we do is the AI collects the data, presents it to the doctor. So a company like Dr. Alan Pitts, his company is radiology, where they are evaluating my understanding is they're remotely evaluating people's images to give them an indication on what their condition may be from the image. Well, that can absolutely be used together with AdviNow as well to give that immediate response either over video, asynchronously over messages or in person.
Okay, excellent. Excellent. And over the next 6 to 12 months, is there anything particularly exciting, any initiatives you have coming up that you want to share?
Well, we're rolling out this partnership with AdviNow, and so our biggest challenge up until this time is it was taking about 3 months to onboard a clinic. And that 3 months to onboard a clinic has been a big burden for us because we sign a contract and the clinic has to assign people and then we have to assign people and then you get 3 months. It's very painful. With this, it's a 5-minute onboarding. And so, everyone has used software before where they're like, hey, free for a month, give it a try, right?
Right.
And you sign up for the free service. And if you continue to like it, then you start paying, or you can cancel, without any liability. AdviNow now enables that into healthcare. So any medical practice can click a button, give it a try, as long as they're using AdviNow, and they can try AdviNow for free. And it will match their exact workflows, prep the notes exactly the way the doctor wants it, code it the way they similarly code their events with justification based off of the payer rules. And it'll all be set up automatically.
Nice.
And so the doctors will love it. They are going to come in and give it a try. And of course, if they like it, they can pay after they, it proves to them that it adds that value to their clinic.
Right. Remind me, there's a name for that type of software. It's free.
Freemium.
Freemium. That's it. That's right. Yes. Freemium.
Yes.
And it's
software
as
a service.
It's great, right?
Yeah, absolutely.
Try it out. You like it? Yeah.
Well, there's the interesting thing with healthcare is everyone promises the world and almost nobody delivers. And that is just, coming from, I'm new to healthcare in 2016. And so in my previous world, if you didn't deliver, your business has ended, right? It's either it's got to work or it doesn't work. But in healthcare, nothing works the way it's promised. It's just really an amazing market. So nobody believes it. And so if you can just show them, prove to them that, hey, they'll get a significant return on investment, then that it's better than any sales pitch I can give.
Yes. Yeah, for sure. And this is such a big idea and can have such a big impact in how we practice or healthcare in general. Yes.
We're looking at growing 100 times between this year and next year, and then 100 times again the year after that. So awesome. Hopefully we'll be one of the largest health tech companies in the state of Arizona, within 24 months. It's the way it should work.
Excellent. And is there an Arizona specific, just because you're based here is the goal, or is there other systems that will be national, which will take you national as soon as you get those sort of agreements?
Most of our large clients are outside of Arizona. Okay. So, we are definitely not an Arizona only company. We are a medical company. And so, obviously we have clients in Arizona, but our largest client is in Florida, believe it or not, which is interesting. And then Texas would probably be number 2.
Okay. Excellent. So stepping back now into your career in general, what do you wish you would have known about building wealth and success earlier in your career?
It's perspective is always an amazing thing, because when you're young, you think you know everything, and you're smart, but you really know nothing. And as you get older, you realize, wow, I really didn't know anything when I was 20. And when you're 30, you're thinking that. And then when you're 40, you're thinking, man, I really didn't know anything when I was 30. And now, I'm 53. And so now I'm 53, I'm looking back when I was 40 and thinking, man, I was pretty stupid. And I imagine that will continue. Right.
Okay.
And so, when I was younger in my career, I really thought success was all about my personal performance.
Okay.
And everyone's smart in the technology field. There's no low IQ people, right? They just don't exist. So I always figured it's all about how hard you work. And I'm willing to put in the time, right? Sleep less, work harder, make sure my family's happy. But outside of that, I work and family, that's all I do. And then what I've realized is it's not really about how hard you work, although that's very important. It's about how smart you work and how smart your team works. And because that's the magnification that really comes as you succeed.
The greater value you're creating.
Absolutely.
Sure. And as you sort of hinted at, it's when you're younger, you're very selfish, right? It's your own individual centric sort of accomplishments.
All about
how you rate your success. And yeah. So,
I remember getting my first real salary after grad school, and I'm like, how great am I? I just put $10,000 into my bank account last month. Wow. I'd never had that much money dropped in my bank account at one time. And I was feeling pretty proud of myself, and after having a few transactions with a few companies, realizing that $10,000 is really not that much money.
Right. You recalibrate.
You recalibrate, and then you're like, well, wait a minute. If I'm worth that much, how much is everyone else worth? And you start to realize that it's really about what you can do with that, not what you can get.
Right. And I've seen people who've reached the top of those mountains and realize how empty they are when it is, doesn't have a greater purpose.
Absolutely.
Right. Okay. Well, I'm excited to see, learn more about AdviNow, as well as see where you take it. That's great stuff.
I've been really blessed to be part of almost every large technical revolution that's happened in the United States since the 90s. I was part of the world's, joined Bell Laboratories, part of the world's first digital cell phone chipset, GPRS that got delivered to the marketplace. Then I was working in the Bay Area, partnered with Apple to create the Apple Watch, partnered with Nest to create, the Nest thermostat, so the Internet of Things, if you will. And then moved to Arizona and was part of self-driving vehicles and electric vehicle technologies, and really had a great opportunity to work with a very large company, Motorola Semiconductor Freescale out here, and was blessed to be able to run the operations for them. And now being part of artificial intelligence in healthcare, it really makes me reflect back on really how lucky I've been to be able to be put in the situations to be part of this. And it's an exciting time. 10 years from now, no job will be the same. Artificial intelligence is going to touch everyone and change everything. And I'm excited to see how it goes.
Yes, me too. Scared and excited at the same time.
Yes.
Yeah. All right. Well, James, thank you very much for your time today and for sharing your insights into the healthcare industry and what the future holds. If people want to connect with you or learn more, what should they do?
You can email me, james.bates@advinow.com. You could learn more about AdviNow by going to advinow.com on the website and look at it and check us out. But feel free to reach out, and we're happy to support your practice if you have a medical practice. And, let's make Phoenix very prosperous.
Is there, for those people, is there a particular size clinic or practice that's a good fit for starting at this point?
We support anyone from a single practitioner practice all the way to large health systems. So anything in between. Yeah.
Excellent. All right. Well, thank you everyone for listening and watching today. Thank you very much, James Bates, for joining me, and we appreciate you sharing your insights into success and impact here in Phoenix.
Well, Tim, I really appreciate you having me on the podcast, and I'm looking forward to working with you.
Yes.
Inspired by our guests? Visit PhoenixProsperityPodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.